This is Chapter 2, Basic Biomechanics. This is one of those chapters that you either love or you hate it, and you have to get through it, so do whatever you need to. I love it, so hopefully that helps you love it too. Biomechanics is the area of mechanics as it applies to the human body. Because the muscular system produces mechanical like movements of the skeletal system, we can apply a lot of the same principles of mechanics and simple machines to the human body, and that's where we get biomechanics. The application of biomechanics to activity analysis is used for clinicians to understand a patient's movement disorders and to design a patient management plan. Some terms that we need to be familiar with as we go through biomechanics include statics and dynamics. Statics are the factors associated with non-moving systems. So we think of static activities as things where you are holding still, either the whole body or a body segment. Dynamics, on the other hand, includes the factors associated with moving systems, and so we associate dynamics with movement. When we look at movement, we want to talk about the kinetics, which you'll recall are the forces producing either the movement or stabilization in a system, and the kinematics, which looks at motion being produced by those forces. Kinematics then further break down into osteokinematics, which you'll recall describes movement of the bones, and arthrokinematics, which describe movement of the joint surfaces. In biomechanics, it's also important to understand the difference between scalar and vector quantities. Scalar quantities only have magnitude, which indicates how much. Examples are going to include things like speed, length, area, something that tells how much there is. Vector quantities give magnitude and direction, so we know both how much and where the quantity is going. Examples of vector quantities are going to include force, velocity, and acceleration, so more of our physics-like terms. But we apply this clinically when we say things like 10 pounds of resistance to elbow flexion with 10-pound biceps curls. So when we document, we want to use vector quantities so that we include both of how much and which direction, with the weight being the how much and the movement being the direction. Forces are things that push or pull on an object, or in biomechanics, body segments. Pushing on a body segment creates compression, and pulling on it creates traction. Forces can be internal or external forces. Internal forces are the things that come from within the body, like muscle contractions and ligamentous resistance. External forces are from outside the body, like gravity or buoyancy or any external resistance, including weights or resistance bands and friction. When we understand the forces that are involved in an activity, we can have a better understanding of which interventions will best help the patient. Gravity is an external force that is defined as a mutual attraction between the Earth and an object. It's what holds us and objects down towards the surface of the Earth, and it is a force that is constantly being exerted on us. Weight is the result of gravity. Our bodies have mass, but without gravity, they do not have weight. So your weight is dependent on gravity. That's why you weigh 1/6 of the amount on the moon, because the moon has 1/6 of the gravity of Earth. Gravity always points down, and this is extremely important to understand as we go through manual muscle testing. In opposition to gravity is the ground reaction force, which is the upward force exerted on an object or body by the supporting surface. Ground reaction force is the reason we don't slowly sink into the earth when we stand in one place. Another important external force to discuss is friction, which is the force between two surfaces that increases the resistance to motion of one surface across another. Friction is a force we are familiar with when we rub our hands together so that we can warm them up when it's cold outside, and when we play shuffleboard, and whether or not we need to push it harder or softer based on the amount of friction. But in the context of the clinic, friction is something that we typically want to avoid because of the soft tissue damage that it can cause. We talk about reducing friction to prevent shearing when we move a patient in bed during bed mobility in order to protect skin integrity. We want to avoid friction with prosthetics and orthotics, so friction is a force to be aware of, especially knowing we want to avoid friction in most instances clinically. We can reduce friction by separating the moving surfaces or applying traction, and we can increase friction by applying compression. Forces can also be named for how they act, and here we can see examples of linear forces. Linear forces are forces that are pulling in the same or opposite direction, but along the same line of pull. So in the first picture, we can see the two people pulling in the same direction along the same line of pull to drag the boat in from the water. And then in the second picture, we can see the two people playing tug of war, applying forces in opposite directions, but again along the same line of pull. Parallel forces occur in the same or opposite direction, but within the same plane. So they don't occur along the same line, but they're still oriented within the same plane. Remember to think back to our frontal, sagittal, and transverse planes. You can see here in this picture that this back brace uses parallel forces, 2 in the same direction and 1 in the opposite direction, all in the sagittal plane to help with an upright posture. This is a good example because parallel forces are often used in bracing in orthotics. Force couples are specific configurations of parallel forces that are utilized in several places throughout the body, so they're important to understand, and force couples act to create rotation. So instead of acting to provide stabilization, like the parallel forces we looked at in the last slide, force couples are parallel forces configured in such a way that they provide rotation. On the left, you can see a common example of a playground merry-go-round using parallel forces, where the two people on opposite sides are pushing in opposite directions, but they're within the same plane in order to spin the merry-go-round. On the right side, we see an example of force couples in the body where the upper trap, lower trap, and serratus anterior all pull in different directions within the scapular plane to create upward scapular rotation. Concurrent forces are when 2 or more forces act on an object in different directions that work together to produce a resultant vector. The resultant vector is determined by both the force and direction of the concurrent forces working together to produce the outcome of where and how far something moves. So this picture shows the practical application of a resultant force. If 2 people are moving this box and force A pushes to the right and force B pushes up, the box is going to move towards the top right. If force A pushes more, the box would go farther to the right than it would up, and if force B were to push more, then the box would move farther up than it does to the right, because the resultant vector responds to how the 2 forces work together. An example of resultant vectors in the human body are how the anterior delt and middle delt work together to produce the resultant movement in the plane of scaption, which falls between flexion and abduction. There are 5 mechanical effects of a result, there are 5 mechanical effects that result from forces on the body, and we're going to talk about each of them here. Traction is the first one. It's a mechanical effect of a force that pulls the joint surfaces apart and places tension on the tissues that hold the joint together. Compression is the result of a force that pushes joint surfaces closer together. We get joint approximation with compression, which can help with muscle firing, but we can also damage articular cartilage with too much compression at joint surfaces, which is how things like osteoarthritis develop. Shear is a gliding effect of a force resulting from surfaces moving parallel to one another. The greatest risk in therapy for shearing forces is skin breakdown during transfers. Bending occurs when the force is not applied at the central axis, causing movement towards one side or the other. When bending occurs, we see compression on the concave side and traction on the convex side. The best example of bending effects in the body are going to be related to posture, where flexion compresses the anterior bodies of the vertebra as we bend further forward. Torsion is the mechanical effect of 2 opposing forces twisting within an object in opposite directions. Torsion typically results in some type of rotary or ringing type motion, and is frequently associated with spiral fractures. Torque is the tendency of a force to produce rotation about an axis. So every time we have movement at a joint, which is an axis, there is torque being generated in the body. The amount of torque generated depends on the amount of force that is applied and the distance from the axis of rotation that force is applied. The perpendicular distance from the axis of rotation is known as the moment arm. So our equation for torque is torque equals force times the moment arm. Adjusting either part of the right side of our equation is going to change the amount of torque produced. I want you to pause and take a minute to think about how we can increase or decrease torque clinically, and why does understanding how to adjust torque matter to things like manual muscle testing. Write your answers down and bring them to class to discuss. The angle of application of force is the angle at which force is applied. This can be constant or variable depending on the machine, but within the body, the angle of application of force changes as a limb segment moves through the range. Any force applied perpendicular to a limb segment is putting all of that force into generating torque. If you remember that force times moment arm equals torque, and that the moment arm is the perpendicular distance from the axis of rotation. With force remaining constant, the greatest torque is generated when the force is perpendicular to the limb segment, because that is when the moment arm is going to be the greatest. Any force from the resultant vector that isn't applied perpendicular to the limb segment results in either compression or traction at the joint. A muscle's angle of application changes as the limb segment moves through the range of motion, so some compression or traction is happening at the joint throughout the range of motion. Which one is happening just depends on where in range the limb segment is located and what it needs for that position. Looking at an example of this, we can see in the first picture here that when the elbow is flexed to 90 degrees, all of the force of the biceps is applied perpendicular to the forearm. So this is the position where the biceps can generate the greatest torque. We also don't have any of that force being lost to compression or traction. But when the elbow bends or straightens past 90 degrees, the moment arm decreases and the resultant vector is changed. We can see in the second picture that elbow flexion from 0 to 90 degrees results in compressive effects at the joint, which helps to improve stability in this range. The third picture shows how elbow flexion from 90 degrees to end range results in traction effects of the joint, which allows for increased range of motion. Understanding forces means we have to understand Newton's laws of motion. The first law says that an object at rest stays at rest unless acted upon by an outside force. So essentially, a force is needed to start or stop movement. Newton's first law can help to explain whiplash injuries. His second law says how much of an object accelerates depends on how much mass the object has and how much force is applied to the object. So if the same object will accelerate faster if more force is applied. If force increases, then acceleration increases proportionally. On the flip side of that, the same force is going to accelerate an object with a smaller mass faster than it is a larger mass. So an object with a larger mass will accelerate at a slower speed than an object with a smaller mass when the force applied to it is the same. This law is where we get the equation for force, where force equals mass times acceleration. Newton's third law helps us to understand ground reaction force. The third law says that for every action there is an equal and opposite reaction. Since gravity is the force pointing down, ground reaction force is the equal and opposite force pointing up. Equilibrium is when the sum of all forces acting on an object is equal to 0, so that the object is static. Achieving equilibrium depends on the object's center of mass, center of gravity, and base of support. In static stance, our body works to achieve equilibrium where we have muscle tone for posture that's just enough to fight or balance or cancel out gravity, but not so much that movement is produced. And so that's where we see kind of that balance of the effects of sway in a static standing position. Going over all of these terms that equilibrium is dependent upon, the center of mass is the point at which the sum of the mass of all body segments is located. And we can find this for a specific limb segment, an extremity, or the whole body. In the adult human in anatomical position, the center of mass is located in the mid-sagittal plane, slightly anterior to S2. A child's center of mass is higher because their head is proportionally larger, so we can see where body distribution can impact the center of mass. The center of gravity is the point at which gravity acts on the center of mass, and so oftentimes these will be the same. When we think about the line of gravity being a line going straight down in the direction of gravity that goes through the center of gravity. The base of support is the area encompassed by the body's contact with the supporting surface. So if you are standing with your feet together, your base of support is the outline of your feet. But if you're standing with your hands on a walker, your base of support would be the outline around your feet and the walker. The degree of stability of an object is determined by interaction between the base of support, the center of gravity, the mass of the object, and the forces applied on the body. We can increase stability by increasing the base of support, lowering the center of gravity, moving the center of gravity closer to the center of the base of support, increasing the mass of the object, and increasing the friction between the object and its base of support. We need this information when we need to increase functional independence by improving patient stability to complete activities. We can decrease stability by decreasing the base of support, moving the center of gravity higher, moving the center of gravity closer to the edge of the base of support, decreasing the mass, and decreasing the friction between the surfaces. And we want to decrease stability when we're trying to challenge a patient in order to improve their balance. We also want to think about these things in the context of functional clinical tasks such as transfers and bend mobility and how we can set ourselves up best for success. Just like we have different types of forces, we have different types of motion, and we need to understand these as well to know what types of motion we are asking our patients to perform. Linear motion is when all parts of an object move the same distance at the same time, like sledding down a hill. Curvilinear motion, like its name sounds, is a combination of curved and straight motion that results in a curved path that is not circular. We can think of a winding path as being curvilinear, or the path a skier takes, or even a falling leaf. Angular motion is also known as rotary motion, and it is when movement of an object happens around a fixed axis. This is the motion demonstrated by the limb segments of the body where the joint is the fixed axis. During angular motion, all parts move through the same angle in the same direction, but they don't move the same distance. So like with long arc quads, your foot is going to travel a farther distance than your shin throughout the movement, but both are still moving at the same angle and the same direction. Simple machines are tools that allow a change of effort or direction in order to move a load. So they're designed to make movement easier, but there's an inverse relationship between the amount of force exerted and the distance over which the force needs to be exerted. So we have a trade-off. If there's less force required, we're going to have to move a farther distance. If we have to move less of a distance, we probably need more force to produce it. Simple machines operate with the exchange that what is gained in power is lost in distance, and what is gained in distance is lost in power. Simple machines provide a mechanical advantage to decrease the force required to move a load, and we have three types of simple machines that we are probably all familiar with in one way or another. Our three simple machines are levers, pulleys, and inclined planes, which all provide a mechanical advantage. The first one we will talk about is a lever, which is a rigid plank that can rotate about a fulcrum when forces are applied. And when we think about it, our bones are rigid planks that rotate around a fulcrum, which are our joints. So our body is filled with levers. This makes levers really important to understand. Levers have two moment arms, one measured for the distance from the axis that the force is applied, known as the force arm, and one for the distance from the axis that the resistance is applied, known as the resistance arm. The force is the effort applied to the lever, and the resistance is the load to be moved by the lever. We have three different classes of levers that are determined by the orientation of the force, resistance, and axis. Remember, the force arm is the perpendicular distance from where the force is applied to the axis of rotation, and the resistance arm is the perpendicular distance from where the resistance is applied to the axis of rotation. The force arm in the body is typically the distance from the joint to the insertion of the muscle that is contracting. When we consider resistance in the body, we typically are looking at the weight of the limb segment being moved and any other resistance that we clinically apply. So in order to find the resistance arm, we have to pick a central point for the resistance to be applied, and we use the center of mass and those things combined to determine the resistance arm. I'm going to go over each of the classes of levers, but I want you to prepare something for class that helps you to review them a little bit more in depth. So if your seat is on the left side of the classroom, you will do this over class 1 levers. If you sit in the middle section of the classroom, you will do this over class 2 levers. And if you sit on the right side, you will go over class 3 levers. But take a minute to pause, read over this slide, and write down your response to bring to class. Our best example of a first-class lever is a seesaw, but first-class levers are oriented with the axis of rotation in the middle and the force and resistance on opposite sides of the axis. Second-class levers are most commonly imagined with a wheelbarrow, which is not pronounced wheelbarrow, and if you don't believe me, go look in your textbook at how the word is spelled and sound it out. It is a wheelbarrow. So anyways, wheelbarrows are a good example of a second class lever because second class levers have the axis of rotation at one end with the force on the other end and the resistance placed between the force and the axis, which results in a setup where the force arm is always going to be longer than the resistance arm, so this provides the mechanical advantage of force production for this lever class. We'll talk about the examples of this lever class in the body, but we also consider second-class levers when we put modifications on things to make them easier to turn for a patient. Think of a doorknob or a faucet with an extension on the handle, creating a longer force arm and making it easier for the patient with a deficit to turn. Third-class levers are oriented in the opposite of second-class levers, and because of that, the mechanical advantage of third-class levers is distance or range of motion when we're referencing the body. Remember that simple machines can help us with force or distance, but not both. So our orientation for a third-class lever is the axis at one end with the resistance on the other end and the force in between the two. This means that the resistance arm is always longer than the force arm, so force is traded for distance in third-class levers. These are just a couple of examples in the body. We can see the orientation of a first-class lever with the force and resistance each on opposite sides of the axis in the cervical spine. We can see a second-class lever with the force arm longer than the resistance arm in the ankle for plantar flexion. And we can see an example of a third-class lever with the resistance arm longer than the force arm with the biceps in elbow flexion. And those examples within the body are great for when all things are normal with no additional weight during a concentric contraction. But life doesn't happen in a vacuum where we only need concentric contractions, so fortunately, levers can change class and respond to different demands. We can change the class of lever by either increasing the resistance the patient is moving against, or work to shift the center of mass, or by changing the direction of movement, which would flip-flop what is considered our force and what is considered our resistance. So we can see in the picture that brachioradialis changes from a second to a third-class lever if sufficient weight is added to the hand to shift the center of mass and therefore the center of gravity more distally so that the resistance arm becomes longer than the force arm. We can also see this change in lever class with changes in direction. So the picture here, the biceps goes from a third class to a second class lever when transitioning from concentric to eccentric contractions. So during a concentric contraction, the muscle acts as the force and the limb is the resistance. So the resistance arm is longer than the force arm, making it a third-class lever during concentric contractions. But upon lowering the hand, the biceps switches to an eccentric contraction, so the muscle becomes the resistance, working to control the weight of the limb against gravity, and the limb becomes the force. So during an eccentric contraction, the biceps has a longer force arm than the resistance arm, changing it to work as a second-class lever. Our next type of simple machine is a pulley, which is a grooved wheel that turns about an axis with a rope or tendon in the body in the groove, providing attachment for an applied force. Pulleys are used to change the direction of a force and or to change the magnitude of the force needed to move the load. Here we have an example of a pulley in the body. We can see fibularis longus hooks around the lateral malleolus so that the bone acts as a wheel for the tendon rope to wrap around and change the direction of pull. So even though fibularis longus pulls up, it causes the foot to go down. We have two types of pulleys, the first being a fixed pulley, which is a single pulley used while attached to a fixed point. This does nothing to affect the force required to move the load, so there's no mechanical advantage for force noted, but it changes the direction of the force, which can be helpful for distance or range of motion. This works great to create a type of first-class lever and is like what we saw with fibularis longus in the last slide. Our other type of movable pulley, which combines a fixed pulley and a moving pulley to provide a mechanical advantage for force. But a movable pulley requires more room for excursion, so it doesn't provide a mechanical advantage for distance. We see these more in weight systems than we do in the body. Last of our simple machines is an inclined plane, which trades needing to travel an increased distance for the decreased force required to rise the appropriate height. Inclined planes are commonly known to us as ramps and are just slanted surfaces that rise from one level to another. ADA guidelines for ramps include that for every 1 inch of rise, we need 1 foot of run from the ramp. So, in order for a ramp to be ADA compliant, it needs to go up. If it say it's a 4 inch step, it needs to be a 4 foot long ramp. The following slides are things that we're going to go over in class before we start with your lab because I think demonstration will help make a lot of these points stick. But I do want you to be able to review this information before class, so I'm going to let you scroll through the following slides so you can read them, but I'm just not going to narrate these slides right now. Finish up reading through them for class. Make sure that you bring any questions that you have and your assigned lever information to class and your understanding of torque and answering of those questions. And we'll discuss those things as a group. And then again, I will go over these slides in class because of having the demonstration, but I will let them play here so that way you can, take a moment to read them.